ephemeral drug reactivity studies till end of 2025, we have 486 papers in the field. And we have a live systematic, every week you just search how many publications are in the field, and we basically send an email to the authors of that publication, congratulations, you made one new paper to this database. So we keep this specific database live every week, making sure we are tracking all the publications in the field. So till the end of 2025, we have 486 papers, okay? Different substances, but they are all ephemeral drug reactivity studies, just to have a sense. And if you want to see them in the context of those, how many biomarkers did we have? 7 biomarkers, okay. In that context of 7 biomarkers, if you want to see them in the context of 7 biomarkers, you can see that those studies can provide evidence for all those 7 biomarkers: diagnostic, response, severity, prognostic, predictive, monitoring. And as you can see here, I don't have the safety because nobody has used safety. And instead, we have severity and diagnostic as 2 different biomarkers. So I can discuss that. But that is a specific framework that we have. And we put the studies that provide specific evidence, for example, for alcohol, for response. So using ephemeral drug reactivity in a trial that you have an intervention for alcohol use disorder, showing the efficacy of, let's say, medication or brain stimulation or whatever, is going to be a response biomarker, right? So we have 49 studies that they provided evidence for response biomarker in alcohol use disorder, okay? And how many of those studies are positive and how much of them they provided negative results, significant, non-significant, in terms of those biomarkers. So that is the framework that we have. So the evidence is moving forward in that specific field. If I want to narrow it to specific areas, for example, from those 486 studies, how many of them are TMS studies? TMS studies that they use ephemeral drug reactivity as one of the biomarkers in their TMS studies. There are 12 studies that they use TMS in their sort of TMS trial, ephemeral drug reactivity in their TMS trials, okay? And as you can imagine, most of them, they used it in their context of response. So there are 9 studies that use ephemeral drug reactivity for TMS, 4 of them for alcohol, 2 cocaine, nicotine, cannabis, and multiple different substances. And 7 of them, they had positive results. Just have a sense how they are being used. So this is the way that people use these ephemeral drug reactivities in the context of different trials. But let's go to what we had before, that specific map that we had. When I showed you the map, we are in the neuroimaging informed brain stimulation workshop, right? So when you see a brain kind of activation, when you see a pattern of brain activation, the first thing that you start would be, how can I target some of those areas? Do you agree? Right? So we are interventionists. So we have the brain activation, and we say, oh, that is interesting. There is a specific cluster here. Any chance that I can target that? There is an interesting deactivation in close to DLPFC. There is a specific activation in DLPFC. Can I just basically target that? Can I just do that intervention into those areas in the brain? So that is the first thing that you start thinking about when you see these maps. And so we basically started working on that specific line of work. One of the specific targeting measures that we have been interested was the interaction between frontopolar cortex and amygdala and nucleus accumbens. And we showed in different studies that a specific connectivity between frontopolar cortex and subcortical areas is important, one of the important drivers for substance use. Okay? And specifically in the context of individualizing that, one of the former postdocs in the lab, Khazale, brilliant postdoc, and she developed a specific pipeline in terms of finding individual maps to be able to target specific areas in that frontopolar cortex to target them for TMS trials. And then we showed that a specific pattern, a specific connectivity that is XYZ axis in the frontopolar area. So and each of those dots would be one patient with methamphetamine use disorder. So these are the different patients that we have in the database. And then we show that that specific targeting would be related to the level of the connectivity, the task-based connectivity, PPI connectivity, would be related to level of craving that people would experience. And then discussing how we can optimize the location of the coil, how we can optimize the orientation of the coil, what Z was discussing in terms of how all those important factors, how we can optimize that. And of course, we try to see how we can use robots to optimize those features, and also how to optimize the dose of the individual, making sure that people would receive the equivalent of dose across different people in the trial, and they have the same level of dose. And those are the discussions. I'm not going to go to the details of that, but that is the idea of how we use that specific pattern in an individualized way, trying to target those areas. Does it make sense? Okay. We published that pipeline, is already available, so people can have access, and the publication is there. Ghazale put together a nice kind of GUI for that specific pipeline, so the pipeline is going to be available. And I will share my slide at the end to the WhatsApp group, so you will have access to all the slides, so you can go through those details if you are interested. So that's a specific pipeline for targeting. And then we have another paper in American Journal of Psychiatry discussing all the evidence for supporting a specific targeted biomarker, not from what we have been doing, but also from the other studies, different studies.